Hey everybody, Dr. Tammy here. In this webinar, I'm going to be talking about folate, MTHFR, and the pregnancy link, essentials for getting and staying pregnant. I mentioned in the last webinar that we'd be talking about this, and I'm going to go into a little bit more detail today. So what is MTHFR? A lot of people hear that term and they think it sounds like something bad, and it can be. So I'm going to go into a little more detail about that. Who will benefit from this webinar? The webinar will provide information on MTHFR and methylation for couples who need to know the impact on their fertility and pregnancy, are wishing to begin preconception care, are currently attempting to or unable to get pregnant, are currently or have suffered from pregnancy-related issues such as recurrent miscarriages, thrombophilia, which is blood clotting, or preeclampsia, which is high blood pressure in pregnancy. Also, moms who have had a previous child diagnosed with an MTHFR-related condition, such as ADD, ADHD, autism, Down syndrome, behavioral issues, learning issues, cleft palate, congenital heart defects, or neural tube defects like spina bifida, and wish to know how to prevent these in future pregnancies, or if you just may have a family history or just want to have a healthy baby and want to avoid these things. So what we're going to talk about is the factors that affect male and female fertility, the correct investigations and pathology testing needed to reveal factors affecting your fertility, how folate and MTHFR specifically impact pregnancy and the growth of the fetus, and how a dysfunctional MTHFR methylation process can affect preconception, pregnancy, or fetal development. So we're going to talk about what specific steps to take before and during for the MTHFR gene mutation issues, optimal diet and lifestyle for those with the MTHFR wanting to get pregnant, and specific nutrients and doses for supporting your healthy pregnancy with MTHFR. So I'm a board-certified family physician who's helped women with hormones and hormone balance for many, many years, and this is a very exciting topic, and I'm going to go into a little more detail about how I came to understand this. I'm not only a doctor, hormone specialist, and natural fertility expert, but I'm also a woman who struggled for 13 years to get pregnant. I understand what you're going through. I remember all those years wanting a baby, and then when I did get pregnant, I lost my baby at 3 months. Miscarriage can be absolutely devastating. I knew it was a little girl. I'd wanted her so desperately, and when I lost her, it was so devastating. And I love this little saying that a miscarriage is a lost pregnancy, a stillborn, it's still a life, it's still a baby. And if you're trying to get pregnant, I want you to absolutely avoid having to go through what I went through. And so I love this. You are not a lost pregnancy or a stillborn, as some have described you. You are not a sad thing that happened to us or a tragic circumstance. You were a baby, my baby, our baby, a human being, and you still are. One of the worst parts was that my doctor couldn't tell me why it happened, which made me terrified to try again. I finally know why, and I'll share that with you, but I want women to not only get pregnant, but stay pregnant. So this is my little man. He's 11 now, and I'm going to share with you the autism connection. My son is on the autism spectrum. He's absolutely beautiful, amazing, such a gift to my life, but it has had a big impact. And had I known what I know now that I'm going to share with you today, we might have avoided some of these issues that he's dealing with now. I've helped thousands of women get pregnant naturally. These are some of my favorites. My nurse practitioner who recently left us, she resigned, and the reason was because she's pregnant, which is great because she had had infertility for many years. And implementing the practices that I taught her, she's now pregnant, and I'm very excited about that. On the right here was a patient of mine, Allison, who was told she'd had severe PCOS for many years and that she couldn't get pregnant, that her eggs were, I think the quote was, too old, and she was just devastated. So when she came in my office, she was crying, and I told her, hey, this is easy, no problem, we got this. And I joked with her that if it was a little girl, she had to name it Tammy. Well, this is her little girl now. She didn't name it Tammy, but anyway, that's just kind of our little running joke. So I want to start you on your road to regaining your life and healing your body to prepare for the baby that's coming. They didn't teach me this stuff in medical school. Why? I have many reasons to think that Big Pharma has every reason to keep you struggling so that you'll buy expensive medications, try expensive procedures, and keep hoping, trying, and feeling like you're failing. I need to give you a little background story to understand how I learned about what I'm going to share with you. I was practicing internal medicine in a little town in Arkansas, and a patient came in with a crazy history. So she told me that she'd had 13 miscarriages. She finally had gotten pregnant and had lost the baby just after it was born at about 3 months with a hypoplastic heart. And then as she told me more about her story, she had history of having family history of heart disease, heart attacks, strokes. Sometimes people as early in their 40s were just kind of falling over, dead with heart attacks and things like that. So her history, her family history and her history were very, very complicated. So I did some research, and I was pretty proud of myself. I found this genetic rare condition called MTHFR. And what I didn't know at the time, that it was actually not rare at all. And now, in fact, this has been many years later, the CDC, or Centers for Disease Control, actually doesn't call it a rare genetic disorder anymore. In fact, about 80% of the Caucasian population has a couple of copies or SNPs of this genetic defect. So just about anybody walking around with any kind of history or family history of crazy things that can include everything from hormone imbalances to severe things like cardiovascular disease probably has some degree of this mutation affecting their life on some level. So then I had other patients with similar symptoms who would come along, and almost everybody I checked for this genetic defect that I suspected it in had at least a copy or two of this genetic defect. So it's very prevalent, and I can guarantee you that if you're listening to this presentation today, that you probably have at least one or more copies of this genetic defect, and it can absolutely affect you. And what I realized was that it had affected myself, and so I have both copies of this genetic defect, and my family has a history of seizure disorders, heart disease. My dad died in his 50s with heart disease. We have a huge amount of cancer, ADHD, and autism as well. So all of these are linked to this MTHFR. So I quickly understood the connection, and the beautiful thing is that it's very easily overridden with a specific B vitamin called folate. The other thing that's impacted my life as well is this is my stepdaughter on the beach, and she has spina bifida, which is a neural tube defect, which is absolutely affected by folate metabolism, methylation, MTHFR. And so I all too well know the seriousness of the impact of this. So it's kind of interesting what happened in our country over the past 30 to 40 years. Nobody really disputes that our food supply has changed as we stopped eating our green leafy vegetables. And so the government said, spina bifida is huge, and it's a huge financial burden to our healthcare. So what can we do about this? Well, the scientists came back and said, well, people aren't getting folate anymore. And so anyway, the government said, well, okay, we got to put folate in the food. Well, it turns out folate is just as expensive to extract as the green leafy vegetables. It would have been cheaper just to subsidize the whole world with green leafy vegetables, but the scientists said, well, folic acid is the same thing, so let's just use that. But I'm going to tell you it's not the same thing, so I'm going to share with you just a little bit about this process and what methylation does. So when you properly can metabolize your B vitamins or methylate, and I don't want to get too complicated here, basically when you can't do that, you have problems with infections, cell disrepair, wrinkles. Nobody likes wrinkles, right? Inflamed gut, lack of new brain cells, stress on the system. You can have neural tube defects, difficulties conceiving, lack of B12, lack of energy. It can lead to cancer and all sorts of multiple issues. And basically what happens is if you can't methylate, you can't clear toxins from your body. I don't want to get too complicated in this process here, but I just show this graph because in the cellular DNA and this methylation pathway, basically what happens is your body has to be able to methylate to clear toxins. And if it can't methylate properly, it accumulates something called homocysteine, which is getting a little more press these days. So I don't know if you can see the homocysteine here in this pathway. It's getting a little more press these days as far as causing inflammation. And this inflammation can lead to inflammation in the arteries, which can cause heart attacks and strokes, or it can cause little infarcts or clots to the blood supply to the baby, and so it can cause miscarriages. And if you have this, you can't clear abnormal hormones from the system, so you're going to have hormone imbalances, and then you also can't clear your toxins. And if you can't clear your toxins, you can't have all these regular processes happening in your body that are absolutely necessary for you to be able to get pregnant. And when I think about the methylation process, it's a little bit like bagging the trash. You know, when you set your trash out on the curb, the trash man knows that that's trash. But let's say you accidentally left your bicycle out there. Well, he'd probably know that that bicycle wasn't actually trash and hopefully leave it. So when this methylation process in your body is confused, you can't clear toxins or abnormal, unhealthy, unbalanced hormones from your body, including estrone that I talked about in the previous presentation. And so everything gets a little bit confused and jumbled up. And a lot of times, even what we see as obesity is just accumulated toxins in the cellular body fat. And so this is a very important process to be able to bag your trash, basically mark it for being discarded through the liver and out of the body. So methylation problems are basically the number one cause of miscarriage and birth defects. It can cause spina bifida, autism. These kids are terrible methylators and they can't tolerate toxins and even immunization. So autism is multifactorial, but this is definitely part of the problem. Things like scoliosis, which I have myself. I think I have one of the most serious, severe cases of scoliosis, autoimmune disorders, anxiety, depression, weight gain, and hormone imbalance, just to name a few. So what exactly is this folate? Well, like I said, folate comes from the green leafy vegetables, and it is a B vitamin. And when I said that the scientists said, well, we'll just put folic acid in everything, it's kind of interesting because folate is completely different from folic acid. So you can see here on the left, the molecular structure is completely different from folic acid. And I use this analogy with progesterone, like I talked about in the previous presentation. Synthetic progesterone can actually kill a baby or cause a miscarriage, whereas real bioidentical progestation, will actually help a woman get pregnant and keep her pregnancy. So it's very different. I like this little picture of the little blue Smurf up here. You can identify the differences. And so when you look at this molecular structure here, you see that the carbon, oxygen, hydrogen molecules are arranged very differently. So it is not the same thing. There's a cute little commercial for Esurance where the lady picks up her son and her son gets in the SUV and says, "You're not my mom." And she says, "Well, I'm age 30 to 40 and I'm driving an SUV and I look a little bit like your mom, but you know, it's just clearly not the same thing." So, you know, it does make a difference what you're actually getting. So I have had stomach problems my whole life, and it's really interesting that when I understood these methylation issues, part of the stomach pain and bloating and issues that people have is just a buildup of toxins in their gastrointestinal tract. And in the next presentation, I'm going to go into this in a little more detail. But one of the things I want to talk about is I use the analogy of do not feed the bear. So there's this thing called SIBO that's getting a little more press these days, and it's for small intestinal bacterial overgrowth. And part of the problem is that this bacteria is out of place. It should normally be in the large intestine, and it's migrated up into the small intestine. And if it's in the large intestine, it's probably fine because it's getting ready to get excreted from the body. But when it's in the small intestine, it can cause a lot of problems. And normally our bacteria in the small intestine digest our nutrients and our vitamins for us. These particular culprits are very greedy, and when they're out of place, they use a lot of our nutrients up, and they actually poop out, for lack of a better term, folic acid. And so if if you have problems with methylation or MTHFR and you can't clear folic acid and you have this small intestinal bowel overgrowth, you are more likely to accumulate folic acid in your system, which can be very inflammatory. And this whole pathway, also with these little SIBO, these little bacteria that aren't supposed to be there, can poop out all sorts of other toxins as well, which can cause methane gas, and that's where you get the bloating and constipation, diarrhea, irritable bowel type things. And so GI is really the root cause of a lot of these problems. But if you have this genetic issue where you can't methylate well and you can't clear folic acid, this is absolutely going to be a problem. So in the next presentation, I'm going to tell you what you can do about that. And as I mentioned, this is just kind of a little illustration here that these bacteria are supposed to be in the large intestine, but they've migrated up into the small intestine here, and basically they poop out the folic acid, which can cause a problem. So pure folate, I like this little illustration here, or methylfolate, is pulled into the cell directly and used. It's a B vitamin that is essential to every cellular process in the body. And when you take folic acid, it has to go through multiple steps before it's broken down into methylfolate. So this is another picture of the transformation of folic acid to methylfolate. And if you have this enzymatic defect or this genetic defect down here at the bottom, this MTHFR, you basically can't go to this final stage of methylfolate. And what's worse is folic acid can actually compete for receptor sites. So if you do get some methylfolate into the system, all this competition for the good stuff and the bad stuff can really start to cause problems. And as I mentioned, these little bacteria basically poop out this folic acid, and it accumulates in the system as homocysteine and can really cause a lot of problems. So researchers have recently studied thousands of patients and found that these homocysteine levels elevated increase your chance of miscarriage by about 38%. So this is huge. This is very, very important. This is a little illustration of the baby growing in the placenta, and you see this complex vasculature is very intricately intertwined. This complex vasculature is very intricately intertwined, and so any kind of defect or homocysteine or inflammation or blood clots in here can absolutely cause miscarriage even before you know that you're pregnant, or even after you're pregnant can cause miscarriages, which again can be devastating. Miscarriage is the loss of a pregnancy in the first 20 weeks, and in many medical articles you'll see that called spontaneous abortion, and can absolutely be devastating. This is an article that was in Reproductive Medicine talking about the polymorphisms of MTHFR and part of the problem. So it's a very prevalent issue, and most mothers discover this genetic condition only after they've suffered several miscarriages. So methylfolate helps maternal tissue growth during pregnancy, helps normal amino acid synthesis, normal blood formation, normal homocysteine metabolism, normal psychological function, normal function of the immune system, and reduction of tiredness and fatigue, and the process of cell division. So what can you do about getting healthy folate levels? Because that's the bottom line. Well, in the next presentation, I'm going to talk about leaky gut, but don't feed the bears. Those little bacteria, you don't want to keep feeding them and letting them continue to pump out folic acid. And be aware that taking vitamins can make you worse if you don't heal the gut first, because if you have that small intestinal bowel overgrowth, you can have an increase in folic acid. And get the right form of methylfolate with B12. It's very important. And we have supplements in our office. You can go online and look for specific forms of methylfolate, which is very important, and avoid toxins as much as possible. There's some great resources out there. MTHFR.net, Dr. Ben Lynch is absolutely amazing. Beyond MTHFR, Dr. Rostenberg, and then all sorts of great sites. So you'll really want to research this a bit more. So I really appreciate you being on this presentation today. The main thing that you can do to get your adequate levels of folate would be to supplement with folate. You can get genetic testing for MTHFR, and eating your green leafy vegetables is one of the most essential, healthy, natural ways. So I usually recommend at least 8 to 12 servings of green leafy vegetables a day, organic of course, because you don't want pesticides that you can't clear very readily. So this is really great, exciting stuff, and understanding this, I've helped women be able to get pregnant and maintain their pregnancy. So thanks for being with me today, and we'll see you on the next presentation.